morning, everyone. My name is Vasundra Touré. I'll wait for the slides to come, but yes, so I will be introducing a little work, or yeah, not so little work that we've done in SPHN to basically try to detect possible semantic drifts in external terminologies, standard terminologies that we are using. So you've heard already a bit of the Swiss Personalized Health Network yesterday, so I'll not go into too much details, but basically what we aim to do is to, what we aim to do is to go from health-related data in hospitals or healthcare systems, and especially clinical routine data, and make it accessible for research purposes in an integrated and fair manner. So we are making use of semantic web technologies for this. And we are also integrating international and national standard terminologies to be able to make it even more interoperable with existing knowledge in the domain. And we are using them at all steps. And as I mentioned, we are using semantic web technologies. So these terminologies that we are using are also provided in the RDF format. So either by the source directly, or we do the transformation. So I mentioned terminologies in my speech now, and this term, in the case of SPHN, we want to actually englobe a couple of terms in it. So we actually mean by terminology vocabularies, classifications, so monohierarchies, polyhierarchies, but also ontologies. So this is just an umbrella term that we are using in our consortium. And what I would like to highlight here is that when we're talking about ontologies, we can have some assumptions that when you have a new concept in a domain that is being developed or built, you usually have a unique identifier associated to it. When you have a new version of that ontology, you also can have new concepts defined, and there usually you have new identifiers for these new concepts. You don't reuse existing identifiers in those cases. And there's also this concept of deprecation, which enables you to say, okay, we had defined this term in the past, but this is not relevant anymore or not used anymore in this new version of an ontology. The problem is that these assumptions can fail in other kinds of terminology, so like vocabularies or classification, so you can't really be sure that these are satisfied also in these cases. And this is where I would like to go. So the data that is coming from the hospitals in SPHN is actually coded with different versions of different terminologies. And we are focusing in this study in three classifications, so which are mainly monohierarchies. So ATCs, which is the anatomical therapeutic chemical classification provided by the WHO. We also have CHOP, which is a Swiss classification for procedures. And we also investigated the ICD-10 GM, so the Swiss version. So just a bit of background. ICD-10 is an English version provided by the WHO. The BfArM, so the German Federal Institute for Drugs and Medical Devices, is building from the ICD-10 GM, which contains the German translation plus some additional codes. And then the Swiss is actually using that as the ICD-10 GM and translate that into French and Italian to provide it to the hospitals. And basically, so CHOP, ICD-10 GM are used in the Swiss hospitals for billing purposes. So in this study, we wanted to find out what's the real, what is really the semantic drift or possible meaning changes that we could observe in these three terminologies. So our goals were to first identify the codes that have possibly changed in their meaning, so that we can also encode this possibility in a machine-readable manner. And the purpose was that we could, with that, improve the quality control during the data preparation steps at the hospital level, but also help the researcher in doing better data analysis, because they are aware that there are possibly some meaning change they need to be aware of. But I think the main or the biggest goal was really also to raise the awareness in our community that this is something you need to be take care of, or be aware of when you're doing your data analysis or preparing your data. So we did a baseline study where we applied a methodology where we compare labels between successive versions of a code of a terminology. So the measure is using the Jaro-Winkler similarity score. So if you had a distance score of 1, it means that your strings were identical, so your labels were identical. If you have a distance score of 0, it means they were completely different. We also applied in some cases, so at some step, some pre-processing step, to be able to remove some non-semantic change that we could be aware of, so like some spaces removed or HTML tags, for example. So you will just see that in the next slide. So we wanted to really capture all possible changes that could be observed in these terminologies. So for ATC, we analyzed codes from 2016 to 2023, and basically each year is compared with the next one, so each codes from a year. On the left part, you can see that this is without any pre-processing, so all the changes that we were observed, and the cutoff is at 1, so you basically have every change that was observed. In the middle one, we applied the pre-processing where we removed like the obvious non-semantic change that we could think of. And you can observe that already we have a drop in the amount of changes between 2021 versus 2020 and 2022 versus 2021. And when we looked into the files, we actually realized that ATC removed some HTML tags in their codes, and that's why here you don't see them anymore. But then we also, on the diagram C, we applied a relaxed cutoff to basically reduce the false positives. And doing so, we still observe that there are few changes that maybe we need to take into account. So investigating further and manually, we could observe 3 different categories of changes in that aspect. So no changes in meaning. So we had a code in 2016, for example, which was labeled as such. And then in 2017, it was changed to this one. We, after investigation, we assessed that this actually is not a change in the meaning because it's really, they're trying to clarify and more accurately describe this chemical compound, and this is the actual name of it. So in that sense, okay, there was no change in the meaning. Then we had codes where there was a possible change in meaning because they splitted the codes. So this example of the metropolol and other hypertensives was the same between 2015 and 2016. But then in 2017, you can see that this code was actually given a different, more narrower meaning. And it was actually a split because you had another new code which also contained another kind of metropolol and something. So in this case, you actually had a change in the meaning because you're narrowing down the scope of that actual code and reusing a code that existed in the past. A third category that we made is that sometimes it's a bit unclear, even to us, also not being domain expert in this chemical classification, it's unclear to assess if there's really a meaning change. So this code in 2016 was labeled combinations, but in 2017, they labeled it as potassium different salts in combination. So not having the full background of that terminology and how they thought about it, but also not being necessarily the domain expert, it was really difficult for us to assess, okay, did they really mean, I mean, what did they mean in 2016? Was it already potassium, but they just called it combination? Or is this really something completely different? So yeah, working with different versions of ATC, I think we need to be careful on the meaning that is being intended. Similar approach with CHOP. So we took codes from 2013 to 2023. You can see that there is quite some changes that were observed, but still applying the pre-processing step and the relaxed cutoff, we still have in some cases like approximately 100 changes between 2 versions, which is quite consequent, and we will need to check what's happening there. So what we observe is that these are mainly renaming or clarification of the code label. So CHOP, as I said, is a Swiss classification for procedures. So they provide codes in French, German, Italian. Sometimes they change the French version. Sometimes it was maybe the German one. So yeah. And it's not always clear what is the semantic meaning? I mean, you first need to understand the language, and then you need to assess what was the change intended here. And then finally, for ICD-10 GM, so which has approximately the same amount of code as CHOP, you can observe that there are lesser changes, so 700 at most here, but you can observe also that there is a gap in some of the versions comparison. So for example, 2023 versus 2022 doesn't have any change in the meaning. You'll see now why. So the changes we observed are, again, language specific, so you need to dig into it to know what's happening. But also, as I mentioned, we are using the Swiss version of the ICD-10 GM. And since they are making the translation to French and Italian, it takes time from when the BfArM is releasing the ICD-10 GM, it takes some time to get the Swiss version. So in 2023, basically, we were using still the 2022 version, so it didn't change. That being said, this analysis guided us to actually implement a versioning strategy in for when we are providing these terminologies. So we first defined version codes, then applied some identity to them, and then provide historized files. So I will just go through them in detail now. First, what we did is that for each version of a code of a terminology, we built a versioned URI. So this code of ATC from 2017 has its own unique identifier in our files. Then we do a lexical match. So we try to apply some identity to it. So whenever labels are identical, we assume that the codes between these different versions are the same. And we do that by adding an OWL equivalent class relationship between these two codes which are identical. If the label differs in any way, we consider them to possibly have a meaning change. So we want to highlight them. In that sense, we don't have this connectivity between these two codes. So you can extrapolate now, I think that, okay, if we do that for consecutive version, you end up with a chain of codes whenever they're identical, that from 2016 to 2017, they were the same. Then 2018, maybe it was still the same. So you still have this all equivalent class and so on. But whenever there is a change, this chain breaks, and you then can interfere and see what you need to do with your data. So all these versioned codes are provided in a single turtle file. So in the latest release, so we are having, for example, ATC 2023 to 2016. And what we do is that in this file, we have the basic codes for 2023. So this is the point of truth. And then we apply, we add all the version URIs and see whether they were equivalent or not. And you get the whole history backed up or filled into one single file. These files are actually provided in our terminology service. So the DCC stands for Data Coordination Center. That's us. And we have RDF versions of external terminologies that are used in SPHN in this terminology service, among which we can find these historical historized files. So how do we use them now? So those version codes are used for data validation purposes at the source. So the hospitals actually have integrated some SHACL rules that we have automatically generated, which contains some SPARQL constraints. So just for those of you who are familiar with it. So basically, the hospitals get some information, additional information or warnings whenever they're using codes that are possibly old or possibly invalid. And then, and then they have to assess whether they need to further check their mapping or if this is okay, and they send out the data to the user. So one example I could highlight is that if the hospital is providing a code that is not versioned in their case, but that code actually had a change in the meaning at some point between, let's say, ATC, we have 2016 to 2023. So if the code has changed at some point in that time frame, they will get a warning, and then they would need to check, okay, can I provide a versioned URI for this one or not? Sometimes you just don't have the information, but at least it gives them some hint on what to do there. We also use these codes for for the user perspective, so they can use those versioned URIs to do better data analysis or more accurate analysis. So if you take this example where you're investigating how many patients were administered with this metoprolol and felodipine drug, you would be interested in querying for the codes from 2017 because that's where this code was really intended for this purpose. So you could trick or change your query, adapt your query to really say, I'm looking into patients that were administered with this specific drug. And, with this chain of equivalent classes we had, even if the data was annotated with 2018 codes, 2020 codes, it will be retrieved. And just to mention, inference needs to be turned on for that so that you can infer on the data, just as a note. So this could help to also assess on the user side, okay, what do I need to really investigate, and how can I adjust my queries to have possibly better results. So this is really our initial work, and we plan to do some further improvement to include more technical implementation. So we would like to try to detect automatically the real semantic changes versus the typo fixes. So as you noted now in the implementation, we flag any change as a difference. So the user needs to assess, what do I do with it? So we could make it more specific and really check what is semantically changed. We can also think about adding more granular relationships. So in the case of the ATC code, we could state that, okay, this code is more narrower now in this new version. So you get more hint at what happens and what's the meaning that you need to observe. And then one other idea is to check for the structural changes in a terminology. So sometimes maybe codes move between structures and then you don't know, okay, what's the meaning of it? So there are some tools or algorithms that are available. We need to further investigate on that and see how we want to add them to our work. So these are some references in case you're interested in digging more into this work. And I would like to finish and thank my co-authors who are highlighted in bold and the whole SPHN consortium in general. Thank you.
It's working, yes. Thank you. Thank you very much for this wonderful talk.
Thank you.
Are there questions? Yes, there are.
Thanks, very nice. I have a question. Do you have an idea of the impact of these changes in terms of data retrieval or some other measure, like if you don't care about this, you get the difference of what, 2%, 10%, 20%?
So we didn't do this in reality. We didn't check, but seeing some changes which were really semantic change, and you saw like this narrowing down or broadening the scope, I guess that could have some impact. Or I could not quantify it, but I would assume that you could have more finer data retrieval, because I mean, if you know that this code was annotated with a specific version and that was the meaning in that version, but this is not what you're looking for. You're looking for the newest meaning of that code in your data analysis, that could actually have an impact. So these, the ATC, for example, is about chemicals. So the procedures are also used for the billing point. So there, all the codes are, quite, you have lots of amount of data on this. So I guess it could be quite consequence, but I don't know exactly what's the impact. That's something we would need to check with our data users when they receive the data, and what do they observe, and does that really help them?
Thank you. Is there one? There's time for one short question and a short answer. Oh, I will get it to you.
Hi, thank you. That was a really interesting talk. It kind of feels like you shouldn't have to be doing this. Do you know what I mean? It feels like the people who are providing those terminologies should be like making the process transparent. Did you feed like back to them or like check their
Not yet. So this is a work we've done last year, but we could try to contact them and see. And that's also, I think, the difference in the, I don't know if I should say quality, but so like, as I mentioned, for ontologies, you could expect that this is covered and checked, and because the level of most of them. So we rely on that, like for ontology, that this is the case, but for classification, maybe it's not so.
Well, it should be though, I guess,
It should be, but I don't know if it's also from their domain, they don't care, or they just think, okay, people just use the latest version, but then for clinical data, you have data annotated with
Yeah.
previous versions,
Yeah.
so then you can't just change it to the new one. So yeah, that's a good point. I think we want to raise it back to the to these providers, but it's not necessary that they will change their process, right? So